All right, let's break down a really common but absolutely crucial case you'll see in your UKMLA PLAB 2 exam, breast engorgement. Ready? Let's get right into it.
Welcome to this clinical walkthrough on the breast engorgement case for UKMLA, brought to you by Medi8, your 24/7 practice partner. In this session, we're going to walk through everything: the structure, the exact phrasing you can use, and all the clinical knowledge you need to absolutely ace this station.
Okay, so here's our game plan. This is the exact roadmap you'll want to follow in the OSCE. It's designed to make sure your consultation is super smooth, comprehensive, and hits all those key marking domains.
Right, let's kick things off with Section 1, setting the scene and your introduction. Honestly, these first few moments are so important for setting a professional and empathetic tone. Just picture it. You're in FY2 in a busy GP surgery, and your next patient is a new mom.
And this right here, this is your perfect opening line. Hello, I'm Dr. Your Name. Could I confirm your full name and age, please? Simple, polite. Then, I understand you've come in today with some breast discomfort. Could you tell me a little more about it? That open-ended question is golden. It invites the patient to tell their story right from the get-go and shows you're focused on them.
Okay, moving on to the real heart of your data gathering, taking a focused history. Getting this right is everything. It's how you'll build your differential diagnosis and, most importantly, keep your patients safe.
So think of these as the main pillars of your history. We're going to cover each one. Sticking to a structure like this means you won't miss a thing, from the nitty-gritty details of the pain to what's really worrying the patient.
First things first, let's really dig into that presenting complaint. You need to get a clear picture of the pain. Is it in both breasts? That might point you towards something physiological, like engorgement. Or is it just one side? Because that could make you think about something like mastitis, right?
Now these questions, these are non-negotiable. This is your critical red flag screen. You're actively hunting for signs of something more serious, like an infection, mastitis, or even an abscess. Asking these questions clearly and calmly is a huge tick in the box for clinical safety in front of the examiner.
And remember, we're not just dealing with breast pain. We're dealing with a postpartum patient. This automatically puts them at a higher risk for blood clots or VTE. So asking about shortness of breath or any pain or swelling in their legs, that's a safety check you just can't skip.
All right, next up, let's quickly run through the rest of the history using a handy mnemonic, PMF-TOSA. Past medical history, medications, allergies, and so on. It's just a really efficient way to make sure you've covered all your bases, like asking about any previous breast problems or a family history of breast cancer.
And this part is so important. This consultation isn't just about ticking clinical boxes. It's about the real person sitting in front of you. Using ICE, ideas, concerns, and expectations, is how you demonstrate fantastic communication skills. A new mom might be terrified this is cancer, or she might be worried she can't feed her baby. Addressing those fears is what makes you a great doctor.
Okay, so you've taken a brilliant history. Now it's time to smoothly transition to the physical examination. And just remember, how you explain this and get consent is just as important as the exam itself.
Just follow these 4 simple steps every single time. Explain what you're going to do and why you need to do it. And crucially, always offer chaperone. It's a hallmark of professional, safe practice. And trust me, the examiner will be looking for it.
When you start the exam, make sure it's systematic. You'll go from inspection to palpation of the breast tissue, then the nipple, and finally the axillary lymph nodes. It helps to talk the patient through what you're doing as you go. Something like, okay, I'm now just going to gently feel the 4 quadrants of your breast.
So for this particular station, these are the findings you're likely to be given. The real key here is that the symptoms are bilateral in both breasts, and there aren't any specific signs of infection. This clinical picture should be pointing you strongly towards a diagnosis of breast engorgement.
Right. You've gathered all your clues from the history and examination. Now it's time to put it all together and explain what you think is going on to the patient. Your main goals here are clarity and reassurance.
This is a fantastic way to phrase it. You state the diagnosis clearly. Based on the symptoms and examination, it looks like you're experiencing breast engorgement. And then you immediately follow up with, have you heard of it before? That one little question completely changes the dynamic from a lecture into a real conversation. Remember to use really simple jargon-free language. Explain what it is, a super common condition where there's just a bit of an imbalance between milk supply and demand. The most important thing is to reassure her that it's very manageable and not harmful if we deal with it now. Putting all these pieces together smoothly when you're under pressure in an exam, it's tough. The absolute best way to turn this theory into a polished performance is to practice. And you can practice this exact case right now and get objective feedback on mymediate.com.
All right, let's move into the final and I'd argue the most important section, your management plan. This is where you give practical, helpful advice and, crucially, provide that all-important safety netting to ensure a safe outcome for your patient.
Your advice here needs to be super specific and easy to follow. Go through these points one by one and explain the why behind each one. So, a warm compress before feeding helps the milk flow, a gentle massage during helps to drain the ducts, and a cold pack afterwards helps with the swelling and pain. This shows the examiner you really understand the physiology behind your advice.
Okay, now listen up, because this is probably the single most important thing you'll say in this entire consultation. You must clearly explain the warning signs of mastitis. Tell the patient you need to come back immediately if you develop these symptoms. This is a pass or fail point on clinical safety. It's that serious.
And finally, let's wrap up the consultation like a pro. Set up a clear follow-up plan, offer a patient information leaflet to back up your advice, and end on a really reassuring note. This leaves the patient feeling supported, heard, and confident in the plan you've made together.
So there you have it. That's the complete framework for acing the breast engorgement station. Now, the real key is turning that knowledge into muscle memory through practice. And you can do that right now by running through this exact case on mymediate.com.